The Prime Minister, in his statement, in his address to the nation, said, "We have seen many videos of people being careless. If you are without masks, you are endangering your family. Till we get a vaccine, we cannot be complacent. Social distancing and hand wash with soap and masks is a must. Slightest lapse can lead to tragedy, and India's death rate only 83 per million. We cannot drop our guard at this moment." He seems to congratulate himself and the people of this country that we've done a good job so far, but we can't slacken. All right, so Dr. Randeep Guleria, Director of the All India Institute of Medical Sciences, as well as Dr. Naresh Trehan, Chairman and Managing Director of Medant-the, the Medicity. Thank you so much, gentlemen, for joining us. I think this was an important intervention, Dr. Guleria, by the Prime Minister. Many people are arguing, well, this is in any case being broadcast all over the country. Even radio jockeys are saying this. Did it take the Prime Minister to come and appeal? We feel, yes, it takes the Prime Minister to come and tell people, more so just ahead of a festive season. Dr. Guleria, do you think that this is our biggest challenge so far, the protracted festive season?
I think so. I think this is our biggest challenge because with great difficulty, the numbers have started coming down. And if you look at the data over the last few weeks, we are seeing a declining trend all over the country. But if we have to sustain this trend, then we have to have COVID appropriate behavior. And as was mentioned by the Honorable Prime Minister, there seems to be some sort of a fatigue as far as this is concerned. And there are videos that we see in many channels of people going into shops, buying saris where there is no physical distancing, no one is wearing masks. People are in a crowd in various functions, which are religious functions because of the festive season. And that is causing a huge concern because we know that any of these functions can become a super spreading event and there can be a huge spurt in the number of cases. And we have examples for this. We've seen this happening in Europe now, that they're having another spike because of the fact that they are having COVID fatigue and no one there is wearing masks and are not following physical distancing. On the other hand, if you look at countries closer to us, to Southeast Asia, we're not seeing a spike in these countries because they've been able to maintain the basic principles of physical distancing, wearing a mask and hand washing whenever they go out. And that's why countries like Vietnam, Taiwan, Singapore are not seeing that much of a spike in cases as has been reported in Europe. So I think we need to see the difference in these two countries, these two areas, learn from that. And that is why I think the Prime Minister has been appealing to everyone that they should actually understand the importance of COVID appropriate behavior, adopt it and do it sincerely rather than just do it as a courtesy and not really wear your mask properly, don't cover your nose and things like that. I think it's very important that there is a strong message from the top for people to really follow this COVID appropriate behavior.
Yes, Dr. Trehan, I want to come to you. See, the point over here is that the last time we saw a spike, and I remember you and many other doctors also saying that, the real impact on the numbers can only be seen 14 days later, because that's when it will start to show, right? The last time we saw festive occasion in the month of August, we saw the spike in September, right? We've just recovered from that spike. Do you think that any laxity right now in this 1 month period is going to have disastrous consequences in the winter months and compounded by pollution?
You know, as the data is showing that we have seen a declining trend from 1 lakh per day to less than 50,000 a day. So this is an inflection point which we must take seriously, because if we do not capitalize on this, we are going to be back into the second peak, which is going to be disastrous, because then, all the gains that we have made in our medical facilities, in our economic status, because the economic engine is just starting. And if we stymie it again, there will be much longer recovery period. So this is the time, and that's why I think that this controversy over what the Prime Minister said or didn't say is not the point. The point is that it's a reminder. People did turn on their TVs to listen to him. And the fact is that the message goes very clear. And he said it very clearly also, that this, although we should feel good, but at the same time, not let our guard down. And also it is appropriately placed just before the festive season. So I think it's a good reminder. I know that media has done a great job. I mean, Dr. Guleria, myself, we all have been on the TV day and night saying the same thing. There are only 3 principles that you can use to protect yourself today. So you're not only protecting yourself, but your family, your community, and ultimately the nation at large. So you must understand that this virus is different from previous viruses. It has an RO factor of 3, where the previous ones had 1, 1.2, and so on. So unless we bring that RO factor down to 1, we should not even think about relaxing. And it's true that there is fatigue. There is no. It is true that people have had cabin fever, but that does not mean that all that what we have gained in the last 6 months goes to waste because now people say we are throwing up our hands. You must understand, you can do a little bit of going out, maintain your masking and distancing and hands hygiene. You can meet people 2 on 2, sitting far apart. Now the weather is beautiful out, at least out here in the Delhi region, although the air pollution is really negating some of that, that you can sit outside where the danger of transmission becomes minuscule. So I think that the important thing is, do not cluster. You know, by nature, we are huddlers. We like to huddle. We like big crowds. We like to be part of it. Just refrain from that. Just put this aside for this period, because the next 3 months are the most critical. If we can maintain this downward trend, then by the end of November, we could see a very meaningful decline in our whole country.
Correct.
So I think this is the moment. He did the right thing. I'm glad he did it. He sent a reminder. The whole substance of the delivery was only this, that till we have the vaccine or a cure, please maintain this discipline.
Correct. Now, I'll come back to you, Dr. Trehan. Now, Dr. Guleria, 2 very interesting things that came in from concerned people, and I want to, I want your advice for them, because these were genuine concerns that came in amid a lot of people who don't follow these simple principles. One was winter clothes. See, in summers, it was easy to request people or to tell them that you come back home, quickly take a shower, take off all your clothes and put them in the laundry basket, and then after that, wear a new set of clothes. You don't do that with your winter clothes. You wear a jacket, the very same jacket, you'll wear it for a week, right, before you give it for dry clean. You may cover your face, but how do you make sure that the virus is not there on your winter clothes?
So that's a very good question, and I think the issues are here are 2. One is, how important is it as far as clothes are concerned in terms of transmitting the virus? And secondly, what can you do when you can't wash your clothes regularly? So for the first part, when we start looking at now the transmission of infection through surfaces, there is data emerging that it may not be that important a cause, but we still need to be careful. And therefore, when you come out, you should remove your jacket, and it will be worthwhile to hang it in a place where there is limited access. Wash your hands after removing it. And if you have to wear it the next day, do that so that it's not in the same cupboard where your other jackets are. You could even hang it close to your door or just behind the door using a hanger. And you could wear it again. And once you wear it again, wash your hands so that if you've touched your jacket, your hands don't get contaminated. Even if you have the virus onto your jacket, it cannot crawl up to your face or nose and cause the infection. It needs your hands or someone's touch to really take it up to your face. So the main important point about surfaces and clothes is that you must wash your hands regularly when you touch surfaces which may be infected, because then you can't take the infection from your clothes or surfaces to your nose or mouth.
I think this is very good advice.
Keep in mind. Wash your hands more frequently, especially when you're taking your jacket off or wearing it, and keep it separate and away from where other people can touch it.
Thank you. That's a very good advice. Now, Dr. Trehan, there was another query related to masks. See, what happens is that during winter months, and I remember coming to Medant-the where you showed me the comparison of lungs. One was a Himachali lung and the other was a Delhi lung, and it shocked me when I saw those 2 pictures. As far as masks are concerned, for pollution, one has to use an N95 mask with a little black dot in the front. Now, people say that's not a good mask for COVID. right? So what do you do in the winter months? Wear 2 masks.
No. Okay, I might just add one more little fact that I think may help to what Dr. Guleria just said about the jackets.
Sure.
That I think that if you rotate your jackets, you let it hang in the air for 24, 48 hours, like we do with masks. You know, even N95 masks, we advise that you have 5 of them and keep them in an envelope and rotate it every 5 days. So maybe it might help that if we can rotate the jacket every 2 days, 3 days, that it may not carry that much viral load as maybe, and we don't even know if it spreads from clothes or not. Correct. But precaution is needed. Now, you're talking about what will happen in these winter months. Now, the tragedy has already started. You saw the stubble burning, the Delhi air, which was so beautiful in the last 3-4 months, took a nosedive. Now, this is already dangerous for people who have pre-existing lung disease, asthma, whatever, infections they've had, pneumonia, tendency for that. Now, those are the people who will get doubly vulnerable, so that they already get that irritation into their lungs from the pollution. And then on top of that, God forbid, the virus enters, it can only make a fertile ground for it. So I think that it's important that we protect the people who have lung disease already, even more vigorously. So the masks you wear are the masks you wear 95 without a ventilator. So the point is, should not be a respirator mask. Okay. Just wear the normal 95 mask. There's no need to go back to the respiratory mask, because of the fact that this one will protect you from the pollution as well as the virus.
Okay, very interesting. Thank you very much, Dr. Trehan and Dr. Guleria, for getting us some tips and taking forward the Prime Minister's message. I'm sure over the next few days there will be more such queries from people, and we'll look towards your advice on these issues. Thank you so much, Dr. Guleria and Dr. Trehan, for joining us.
Welcome.